voting booths, but that's fine. Today, Brenna will be giving the presentation today. As you can see up here, the topic is neuropathy. And
who's Brenda?
She's Dana.
Darn, Dana. Sorry.
What happened to you?
It's been a busy week, guys, even though it's just Monday for me. I apologize.
Osmosis.
Yes.
That's our job.
We had a lot of new providers that we hired last week, so I have a lot of things on top of my mind. But anyway, my apologies. I'm sorry. But we'll start here shortly. And again, these presentations are designed to be about 15 to 20 minutes. And the importance of these presentations is the questions and answers after we talk. Okay? So, questions and answers can pertain to the presentation itself, but you guys can ask us anything, both on an individual level as well as if you have a public question. You'll be more than happy, we are more than happy to answer those questions. So we'll start here in a couple of minutes.
Chair.
Okay.
Thank you.
No.
Should I go off?
Yeah.
Hello. As long as she knows who she is,
Yes.
that's the important part.
As long as you guys know her name, it's all good, all right?
It's fun because it's us who are supposed to figure This is such a nice place.
That's mine, yes.
That's okay.
Arlene, they're bringing some more, I think, right here.
What?
They're going to bring some more chairs, right here.
Okay.
Dr. T fixed chair.
Thank you. Can you get around that? Cheryl, can you get one?
All right. Can everybody hear me this time?
No.
Still no?
In the middle, right in the middle. That close. It's very sensitive.
Can you hear me now?
Yes.
Great. So my name is PA Dana Spero, as most of you know. I am a PA with SeniorDoc, so thank you all for being here with us this morning.
He's not looking at me.
So the whole talk today is about what is neuropathy. So some of you know what neuropathy is, you've experienced it for yourselves, or you've heard other people talk about it. And what we're going to do is go through some of the causes, the symptoms, and the management of neuropathy. If I go too fast, tell me to slow down. I'll do my best to slow down. By the way, this is a little cartoon of a nerve cell, what we call a neuron. So it's just simple and black and white. And I think that Cheryl passed out a few. I only printed out a few of the handouts just in case.
Yeah.
Just in case there are some people that were very visually impaired and couldn't see the slides.
Thank you.
So neuropathy is a condition that results from damage to or dysfunction of one or more nerves in the peripheral nervous system. Understanding neuropathy is crucial for early detection, effective management, and prevention of complications. And we're going to go over the anatomy of the nervous system. So the nervous system consists of the brain. The central nervous system consists of the brain and the spinal cord. That's what you can see up here in pink. And then the peripheral nervous system, which is what we're talking about today, is in yellow. So there you go. The peripheral nerves transmit signals between the body and the central nervous system. So damage to these nerves in yellow are what results in neuropathy. There are several types of neuropathy. We're going to start with peripheral neuropathy, which is the most common. A lot of you have heard of diabetic peripheral neuropathy, so that's the neuropathy that people with blood sugar problems get. They get it in what we call the stocking and glove distribution, so in their hands and in their feet. And it causes symptoms such as numbness, tingling, and pain. That's also a little picture of several nerve cells connected together there on your right. Autonomic neuropathy affects the nerves that control involuntary bodily functions, leading to problems with digestion, heart rate, and blood pressure. So these kind of problems are gastroparesis, or slowness of the GI tract, some types of heart arrhythmias, and something else we call orthostatic hypotension, which is when you stand up and your blood pressure drops precipitously, which is not good because we need blood up to the brain. The next one is proximal neuropathy. So this affects the nerves in the thighs, the hips, or the buttocks, and it causes weakness and pain in those areas. And then lastly, focal neuropathy, which affects a single nerve or a group of nerves, resulting in sudden weakness or pain in a specific area. So the best example of focal neuropathy is carpal tunnel syndrome. So I don't know if you all are familiar with that, but the carpal tunnel's in your wrist, and very commonly for people like me that spend a lot of time on their computers and doing desk type work, you get compression of the median nerve, and oftentimes requiring surgery. So, causes of neuropathy. So, diabetes obviously is high blood sugar levels can damage nerves over time. Sometimes people suffer from accidents, falls, or sports injuries that can lead to nerve damage. Viral or bacterial infections can cause inflammation of the nerves. A good example of this is shingles, which is caused by the herpes zoster virus. Conditions like rheumatoid arthritis and lupus can cause the immune system to attack nerves, resulting in neuropathy. There are certain drugs that we prescribe, oftentimes chemotherapy drugs, and there are some antibiotics that can cause neuropathy as a side effect.
Can you mention the name of the antibiotic?
We can do questions at the end.
Okay.
And then there are also some individuals that inherit genes that predispose them to neuropathy. So there are actually some congenital disorders that people are born with they actually have the symptoms of neuropathy from birth. I heard slow down. Okay. Symptoms of neuropathy. So numbness and tingling is one of the most common symptoms of neuropathy. Sensations of pins and needles or loss of sensation, oftentimes in the hands and the feet. Some people experience sharp, stabbing, burning, or shooting pain that may be constant or intermittent. Some people experience muscle weakness, so they have difficulty moving or controlling their muscles. And some develop loss of coordination, so they have difficulty maintaining their balance or difficulty performing fine motor tasks like even signing their name or dropping something on the floor and having difficulty picking it up. And then some people also, at the bottom there, it says sensitivity to touch and or temperature changes. The best example I have of this is I have patients that will tell me they can't stand the sheets on their bed touching their feet at nighttime. So it really, even just the light, airy sheets, they have to have their feet sticking out out from under the covers because their neuropathy really gets triggered by something like that. So how do we make the diagnosis of neuropathy? So healthcare providers like myself or Dr. Thomas will ask you about your symptoms and perform a neurologic examination. There are also tests such as EMGs, which stands for electromyography, and nerve conduction studies that can assess nerve function. This is the test where they put little needles in your muscles, in your arms and legs. I don't know if anyone has had this before. I've had it myself. It's not as painful as everyone screams about. So they actually send a little electric current through, and they send the electric current through to your muscles, and then they measure whether or not the nerves are conducting electricity properly to the muscles, and whether the muscles are sending electricity properly back to the nerves, and they measure the speed at which that happens, and in that way they can actually diagnose the very specific neuropathy that you have. There are also blood tests that we do to check for underlying conditions such as diabetes and also vitamin deficiencies. I often check people for B vitamin deficiencies because the B vitamins are responsible for a lot of neurogenic processes in the body. So we try our best to treat those things. Not all of these vitamin deficiency neuropathies are reversible. So we will supplement you oftentimes with B12 or a B complex vitamin, and sometimes it helps with neuropathy and sometimes it does not. And then finally, imaging studies like MRIs or CAT scans are useful, especially to identify if there's a structural problem. So if you have a mass that's pressing on a nerve or tumor or any sort of unusual abnormalities, the CAT scan or the MRI can sometimes pick those up to identify the cause of your neuropathy. Complications. There's a lot on this slide. So this is why we care so much about neuropathy, is because neuropathy causes a lot of complications, especially in people your age. So one of the things we see very frequently are foot ulcers, which can lead to foot infections. And so there in the bottom, in the middle bottom there, you see a foot with an ulcer on the bottom. And what can happen is because people can't feel the bottom of their feet, they end up getting little sores that would be nothing if it were people that could feel the bottom of their feet. But then it gets worse and worse, and because of other underlying conditions like diabetes, doesn't heal well, and then ultimately can get infected. So that causes major problems with mobility, etc. And then loss of balance and coordination, which is one of the major symptoms of neuropathy, can actually lead to falls and injuries. Autonomic neuropathy. So autonomic neuropathy is responsible for a lot of these automatic things that happen in our body, these automatic functions. And one of those are the nerves that control blood to the genitals, so it can actually lead to erectile dysfunction. It can also autonomic neuropathy can affect the blood flow to the digestive tract, and that can cause what we call gastroparesis. Symptoms like constipation and diarrhea. And then even cardiac issues or heart issues, because the nerves that control the heart rate, the blood pressure can be affected by neuropathy. And then we have issues like I mentioned, orthostatic hypotension or different arrhythmias. So what do we do about it?
What can we do? Tell us.
I know that's why you're all here. So treatment options. So medications are always the first thing that everyone would like to discuss. And so we have pain relievers, we have antidepressants, we have anticonvulsants that we often prescribe to help manage the symptoms of neuropathy. So some of the ones that you may have heard of are gabapentin or Neurontin, pregabalin or Lyrica, duloxetine or Cymbalta, just to name a few. Some of these medications help, and sometimes they help some people and they don't help others, and really it's about trial and error and figuring out what medications may or may not work for you. Physical therapy and occupational therapy are really important to help improve strength, mobility, and coordination. The transcutaneous electrical nerve stimulation, or TENS unit, which has been around for a long, long time, actually is a low voltage electrical current, somewhat similar to what I was describing with that electromyogram test. But it's a low voltage electrical current that we send to those areas where people are experiencing pain, and sometimes that helps with long-term pain relief. Maintaining a healthy diet, so exercising regularly, avoiding harmful substances like alcohol and tobacco can help manage neuropathy symptoms. So first of all, overdoing those things can actually lead to neuropathy, but if you already have neuropathy, cutting back on those things can actually improve your symptoms. And then surgery. In severe cases, even carpal tunnel syndrome, like I mentioned, which is a focal neuropathy, you sometimes require surgery to either remove the damaged nerves or sometimes reposition the damaged nerves or remove a tumor or something that's compressing on the nerve. Management strategies. So regular checkups with your healthcare provider, physician assistant, doctor, nurse practitioner are important for monitoring symptoms and adjusting treatment as needed. Proper foot care is very important. So Dr. Hirsch is one of the podiatrists that comes here. A lot of you know him, who does regular foot checkups. That helps prevent foot ulcers and injuries and helps catch these things when they're small so that they don't become big problems. For individuals with diabetes, maintaining good blood sugar levels can help prevent or delay the progression of diabetic peripheral neuropathy. And then in addition to the medications we talked about and therapies, there's other techniques. This is a picture of a woman getting acupuncture. I assume it's a woman because she has red toenail polish on, but I guess, you know, we're in the Palm Springs area, so you never know. So she's getting acupuncture. I've had acupuncture myself, so if anyone ever wants to talk to me about it, I'm happy to talk to you about it. I think it's a great alternative therapy. Massage therapy and relaxation exercises can sometimes help with neuropathic pain. And then support groups is here on the bottom, because as you all know, a lot of people suffer from this disease, and actually talking about it helps, believe it or not. So joining a support group or seeking counseling can provide emotional support and practical advice for coping with neuropathy. And there's a saying, I think it's something like an ounce of prevention is better than, what is it?
Worth
a pound of cure. Thank you. I meant to Google that last night. I just had it on the tip of my tongue, and I was like, someone will yell it out. Thank you, Candy. So prevention, how do we prevent these neuropathy symptoms? So a healthy lifestyle is really important. Like I mentioned, eating a balanced diet, exercising regularly, maintaining a healthy weight can help reduce your risk of developing neuropathy in the first place. Proper management of conditions like diabetes, any sort of infections, autoimmune diseases that you might have can help prevent neuropathy or at least delay its progression. Limiting alcohol consumption and avoiding tobacco use can help protect nerves from being damaged. And then engaging in regular physical exercise actually helps improve your circulation, it strengthens your muscles, and it promotes nerve health. And regular visits to your healthcare providers, people like me, physician assistants, doctors like Dr. Thomas, nurse practitioners like Lorraine that I think some of you have met here from SeniorDoc. You know, we can do screening tests and we can identify and address any risk factors that you might have for neuropathy or help diagnose neuropathy. So many patients have shared with me their personal stories of the challenges of living with neuropathy, as well as their strategies that they use to manage symptoms and improve quality of life.
Did you draw that?
I did not. But did you notice that he only has like 4 toes on 4 fingers? And I thought, did he already have his pinky toe amputated, this poor guy? Anyway, the little cartoon bubble is going zzz, because some people experience an electric shock sensation in their feet or their fingertips. And he's kind of in his pajamas, and the point is these neuropathy symptoms are keeping him awake at night, and it's really troublesome for him. So the other day, I had a patient here who shared with me that she uses, her name is Lois, she's here with us. She brought some of these devices here that are up front over here on the side that you guys can look at when the talk is all over. So what they are little foot massage machines and foot warmers, and they sort of help improve the circulation in your feet, and it stimulates blood flow and alleviates a lot of neuropathy symptoms. So one caution I would say is that for people that have very severe or advanced neuropathy, if you really can't feel the bottom of your feet These devices aren't that great for you because you could wind up with a sore on the bottom of your foot if you can't feel the heat or if you can't feel the bottom part that's actually massaging your feet. Another thing that patients bring to me all the time is they swear by different topicals. In other words, creams, balms, ointments, sprays, patches, things that they found over the counter that really help. And there's a number of ingredients that I see that are common in all of these topical things that people bring to me. So a famous one is Tiger Balm. Tiger Balm, for example, has camphor and menthol and methyl salicylate, which has an anti-inflammatory effect. Some of them have lidocaine in them, which you kind of wonder, well, if my feet are numb, why am I putting lidocaine? It's going to numb my feet. Well, some people don't just have numbness. Some people have this burning pain, this electric shock type feelings. And sometimes people can't describe this neuropathy. They say, I just can't even tell you. It's just, and they're just so upset by it and frustrated by it, and they really have difficulty describing it. So creepy, crawling, I've heard all kinds of things. We can talk about it. You guys can call it out later when we do the question and answer portion. All right, so this stat up here, I don't know if you can read it, but this is from Yahoo Finance, and it's projected that the neuropathic pain market research is going to reach $13.25 billion globally by 2032. So what does this mean? It means there's a lot of people suffering from this disease. There's a lot of researchers that are actually doing ongoing treatment. They're continuously studying neuropathy to better understand its underlying causes and also to develop more effective treatments. Some emerging treatments are regeneration therapies and gene therapies that hold promise for future management of neuropathy. And we know that continued research is essential for advancing our understanding of neuropathy and improving outcomes for individuals that are affected by this condition. So in conclusion, neuropathy is a complex condition that is characterized by nerve damage or dysfunction that leads to a range of symptoms and complications. Early detection and treatment can help prevent or delay the progression of neuropathy and improve the quality of life for those who are affected. And individuals experiencing symptoms of neuropathy should seek medical attention for diagnosis and management, and they should not hesitate to reach out for support from their healthcare providers, from family, and from support groups. And that is all I have for you today. Oh, and I just doing the research for this talk, I discovered that the National Neuropathy Awareness Week is May 12th through the 16th this year. That's all I know about it, but we can Google it. So I'm going to open it up at this time for questions, comments. Even if you just want to share your own personal experiences with neuropathy, whatever you guys would like to talk about, you're up. And Dr. Thomas is going to join you, right?
Yes.
I just wanted to know, does SeniorDocs have a contract with someone that does acupuncture and that they would come here?
We do not.
Maybe we will.
So what Candy was asking is, do we have a contract with a provider that does acupuncture, and could we get them to come here? But that's a very good question. So at this time, we don't.
And some insurances won't cover it, so maybe that's an issue too.
Correct. So a lot of sometimes it's considered alternative interventions. Sometimes they're covered by insurance. Acupuncture for a lot of ailments, especially pain issues, is covered by certain insurances. I have referred people to a local office here. A lot of times when we deal with interventions, it has to do with the equipment and positioning of the patient. So having an exam table for them to lay down on, sterile equipment, sometimes it's very hard to go from an outside office-based location into a mobile practice.
Okay, thank you.
Yes, back there.
I think for this group, it's important that they have a differentiation between musculopathies and neuropathies, referring that musculopathies are those things that are caused by pressure on the spinal cord itself rather than peripheral damage.
Yes, so he was just differentiating between myelopathy versus neuropathy. Is that right?
Musculopathy.
Musculopathy is the term he's using. So pressure on the spinal cord is a central nervous system problem because at the very beginning of the slideshow, there was the human body up there, and in pink was the brain and the spinal cord, and yellow was the peripheral nervous system. So this whole focus is on peripheral neuropathy, referring to the areas of where nerves are compressed, where the yellow nerves are compressed. Yes.
When you mention alcohol as being a factor, it's abuse of alcohol, right? Not just a couple glasses of wine at dinner.
So for women, moderate alcohol consumption is 1 alcoholic beverage per day, and for men it's 2. And so moderate alcohol consumption is okay and can actually have some positive effects on the health, on the cardiovascular system. And Dr. Thomas gives a good talk on hypertension where he shows you what a 4 ounces of red wine looks like versus what the restaurant pours, which is more like 6 or 8 ounces. So moderate alcohol consumption does not normally contribute to neuropathies, but anything more than that absolutely can.
So to explain that question or answer further, when people develop neuropathy, okay, numbness and tingling in their feet and hands from alcohol consumption, it has to do with vitamin deficiency, okay? When you consume alcohol, you lose certain types of B vitamins, all right? And when that occurs, over time, the nerve covering of your nerve cells starts to fall apart. And that can develop neuropathy in your feet and hands, as we said earlier.
That's why we supplement people that do overindulge in alcohol with thiamine and folic acid, is to help treat those neuropathies.
But don't think if you drink a lot of alcohol, just because you take your vitamins, that's the excuse, okay, guys? All right. We still have to be cautious about overconsumption, and I know a lot of you like to socialize here. Some other communities, they drink more. They have little wine bars or beer tap, and it just, again, too much of a good thing is a bad thing, unfortunately. That's how life works.
I have neuropathy, and what seems to happen is I get faster heart rates at the same time. And I have found that taking electrolytes just calms everything down. What's that all about?
So what you're describing is an autonomic neuropathy.
Yeah.
I'm not quite sure why electrolytes help, to be perfectly honest. Do you have any insight into that?
Placebo effect.
Okay, so when we talk about electrical activity, okay, we're going to get back to basic science here. How many of you were like a biology or chemistry major in college?
Not major, but
Okay, so we got a couple people here. All right. So electrolytes, sometimes you can view electrolytes as your acid-base status, okay, or a positive charge or a negative charge depending on your the electrolytes that you're taking. So the action potentials, how electricity works is action potentials. You go from a positive to negative charge, okay? So sometimes when you take electrolytes, you balance kind of your acid base or your positive negative charge in your body. Okay? I'm explaining this in a simplistic form, okay? But it's all about regulating the action potential of your nerves firing. So if you can settle that down by introducing a substance such as electrolytes in your body that have a charge to them, you can slow down that action potential. And when you slow down the action potential in your body, you can slow down your heart rate, okay? Remember, heart rate, all it is electricity, okay? It's stimuli, okay? You have a command center, a node center at the top part of your heart, okay, your SA node, all right? And if you slow that down, you slow down the how fast your heart rate beats, okay? And also you can slow down the firing of your nerves, which can sometimes reduce neuropathy.
Yes, go ahead.
When they say that it's idiopathic, I know it means they don't know, but how important is it to really find out what the cause might be? If they say it's idiopathic, should you pursue finding out in a more detailed way?
So in general, once a medical provider tells you that something is idiopathic, I assume that that means that they've already sent you through a whole rigmarole of tests. They've done a neurologic exam on you. They've sent you for some, blood work studies. They have sent you to, maybe have a CAT scan or MRI or an EMG, and they've done their due diligence to try to determine, what is this neuropathy and what caused it. Maybe even sent you to a neurologist to help find out what is this neuropathy and what caused it. So it is important, but then you're right, there are some people that wind up with this diagnosis that nobody's happy with, idiopathic neuropathy, or idiopathic peripheral neuropathy, or idiopathic polyneuropathy is another term. So, we do our best to try to figure out what it is. If you're not happy with it, certainly getting a second opinion, maybe from a neurologist. But we still treat the neuropathy in the same ways, regardless of what the cause is. So if there is an offending agent, like alcohol, for example, we try to remove the offending agent. Or if it's a chemotherapy drug, you need the chemotherapy in order to survive. So sometimes you finish with the chemotherapy drug, but you're left with neuropathy. Well, you have to take the good with the bad. So then we still treat the neuropathy in whatever way we can, and that's when we use medications like gabapentin or pregabalin or Cymbalta, they're the top 3 that come to mind, to treat the symptoms of neuropathy. And in those cases, we know what the cause is, but we can't do anything about the cause. So we do our best, but if you're still bothered by it, then seek a second opinion.
So important concept, you bring up the word idiopathic, which unfortunately is a term that we don't know what's going on, okay? You have to understand that in medicine, a lot of things is not black and white. When we order tests, imaging tests, biopsy tests, lab tests, it's not like we get the result back and it says, okay, this is what the patient has, okay? If that was the case, guess what? Our jobs would be 1,000 times easier, all right? We have to make assumptions, okay? If we can make an assumption to a diagnosis, we give you the diagnosis and then we come up with a treatment plan, okay? If an assumption based on our imaging and labs come back, okay, and it doesn't steer us toward a definite diagnosis, then we change our mindset we start excluding things, okay, and then we make a diagnosis. Okay, so either labs are going to tell us what the diagnosis is by interpretation, or they're going to tell us what it not is, and then we're going to come up with a diagnosis by exclusion. Okay, this is an important concept that all you should understand. Now sometimes when this happens, the numbers, pictures, or biopsy, they don't tell us what it is, and the results are too confusing, so they can't tell us what it's not. And then you get this kind of garbage diagnosis of idiopathic, okay? We don't know what it is, and even if we did, we could call it the Carlotta neuropathy, okay? All right? Okay? All right? Even if we give you that diagnosis, we're still just going to treat symptoms to the best of our ability, okay? But what Dana said, like things like gabapentin, pregabalin, Cymbalta, amitriptyline, okay, all those kind of type medications, and then we see how you respond to those medications. So again, there's an art to being in the field of medicine.
Yes.
I have a question. I go to pain management for my neuropathy, and they say that I'm on gabapentin, and they want me to take Cymbalta with it. Have you heard of that combination?
Oh, yes. We try everything to treat people's neuropathy, and including combining medications. So Cymbalta and gabapentin work in two completely different ways to treat the neuropathy.
As
So-
they say, they work well together, and so far I've been afraid to do that.
Well, my usual course of action when I'm treating the elderly is to go slow. So start low and go slow, especially when you're combining medications. So I'm sure that your medical provider is aware of your age and aware of your other, coexisting medical issues. So if they're making the recommendation and, they're giving you, these are the risk versus benefits, it's up to you to decide if you want to try the treatment or not. Depends on how bad you're suffering and what you're willing to try. You're welcome. Lois.
Yes, we often hear it's age-related. Is it age-related?
Well, young people get neuropathies too, like there are people that are born with them. But nerves do degenerate like the rest of our body. Every part of our body is degenerating every single second of every minute of every hour of every day. We cannot stop time, unfortunately. And so it is, certainly neuropathy is more common in people as they get older, and we do have an aging population, on this planet. So I think that's partly why they're putting so much research money into treating neuropathic pain, as I mentioned. So, I don't think that you can just dump it onto age, like age is the cause, but age is definitely a contributing factor. Sorry. Yes, sir.
Is there regarding the feet, is there a relationship, cause and effect between peripheral neuropathy and capillaritis in the feet?
Peripheral neuropathy, and what was the other thing?
Capillaritis.
Okay, so the question is there a correlation or relation between peripheral neuropathy in the feet versus vascular issues in the feet? Okay, all right. The specific term the gentleman used was capillaritis, but I would say we tend to like to use the term vasculitis as more of a general term. So the answer is yes, they're 100% related. Okay. When you talk about inflammation, you asked a question about aging, okay? A lot what we do in the geriatric population is try to manage inflammatory loads or stresses on the human body. As you age, your risk of forming chronic inflammatory processes, okay? Rheumatoid arthritis, some of you have this in this room, okay? Histories of long-acting diabetes or high blood pressure, okay? All these are stressors on the body. Stressors lead to inflammation. Inflammation leads to higher action potentials in your nerve fibers. Higher action potentials or higher firing rates in your nerves can cause neuropathy. Okay? So, we also have to remember that a lot of times people develop neuropathy because of X. Okay? Vasculitis, okay, or the term that was used was capillaritis. I haven't heard that term before, but small vessel disease, okay, all right? So, yes, we control the small vessel disease to minimize the neuropathy. If we're just treating neuropathy and not trying to minimize the vasculitis or inflammation in the blood vessels, we're not doing our job as providers. Ask away.
It's not a question. I need to make a general statement, and I think all of you will agree with this. You guys are like gold, not just because you have knowledge, but the skills that they use to explain things, and you just go through everything in order, because I had all these questions and it was the next slide. So I'm feeling very blessed to have you guys here. I really am. I think it's awesome.
Thank you so much. Thank you.
I have another question.
Yes.
I stopped treating neuropathy with gabapentin. Is that bad? Should I be treating it? I don't really notice a big difference.
It all depends on how bad your symptoms are. So gabapentin is not something that actually heals the nerves. What it does is it treats the pain that you're experiencing due to damaged nerves. It doesn't actually fix the damage. So, and a lot of the medications that we use, gabapentin, Cymbalta, pregabalin, these medications do not actually repair the damage, but they do help treat the pain symptom. So it's really up to you. How bad is the pain, and whether or not the gabapentin is, you have to make the decision about whether or not, you know, the side effects of the gabapentin are worth the benefit that you're getting from treating the pain. Yes, sir.
A similar question. I was probably diagnosed diabetes 20 years ago or so. My first diabetes doctor said when I said I have neuropathy, he says, you can take medications. I said, what if I don't want to? He says, that's a good thing. There's always side effects for any of those things. As long as you're comfortable, you know, I rarely have pain. So I just don't treat it. Is that good or bad?
So, you know, you don't have to treat neuropathy, meaning you don't have to actively take a prescription or go have acupuncture or do massage if you're not bothered by the neuropathic symptoms. But what if your symptom is numbness?
Oh, that's what it is.
But what if you don't, so what if you don't know what's happening on the bottom of your feet? So the treatment for you, sir, might entail making sure you're seeing a foot doctor regularly, making sure that you yourself are looking at the bottom of your feet, or if you can't bend to see the bottom of your feet, showing someone else looking at my feet regularly, you know, or making sure your medical provider, like myself or Dr. Thomas or nurse practitioner, whoever you see, is routinely doing checkups and monitoring those parts of your body that are numb.
And I've always done that.
Very good.
Maybe not every day, you know, but I see the foot doctor on a regular schedule.
Right.
And I have, what's the other thing, you go to, the gals that do your nails.
A mani-pedi?
Whatever that is. So
Pedicure.
Seen, you know, more or less frequently, so.
And you have a wife.
I appointed a committee of one to do that on some sort of even speeded up schedule.
So we've had some similar type questions, and I think they're all great questions. What I want to clarify, especially these last statements, it is okay not to treat symptoms if they don't significantly impact you as an individual, okay? It's a different discussion to actually treat the root cause, okay? So, for example, you don't have to take gabapentin for neuropathy because your symptoms are not that bad, okay? But if you have diabetes, okay, or you drink 5 glasses of wine per day, okay, we have to treat those issues, all right? Because we don't want these problems to get worse. So you don't have to take gabapentin, but you do have to see the podiatrist, the foot doctor, to make sure you have good foot health, okay? You don't have to take gabapentin because your symptoms are mild and manageable, but let's say that you have vasculitis, meaning inflammation of the vessels in your lower feet. Well, then taking a baby aspirin per day is something we would strongly recommend. So those are two different kind of thought processes.
Thank you.
Because you did say neuropathy is not curable. You can't reverse it, right?
Depending on what the cause is, okay? So neuropathy is reversible to some aspects. So if you have poorly controlled diabetes, okay, meaning high sugar load is damaging those vessels, okay? If we control the diabetes, we can reverse some of the effects of diabetes on neuropathy, okay?
Does neuropathy cause nerve damage, though? If the nerves are damaged, they won't repair, correct?
I just got you.
So neuropathy happens because the nerves are already damaged. So can nerves repair themselves to some degree with time? Yes, that's possible. But there isn't a specific intervention that we can do to repair the nerves for you. Your body may repair the damaged nerves to some degree, but to a very limited extent. What you can do, or what things that I mentioned when I was going through the slides, is you can do your best to manage your healthy lifestyle. You know, to eat and drink and drink healthily, to eat a wide variety of fruits and vegetables, to try to exercise regularly because those things improve circulation in your extremities, to, you know, take good care of yourself. Don't overindulge in toxins like alcohol and tobacco. So there are things that you can do to manage neuropathy. But is there a specific cure? No. But when treating the underlying disease is vital. If the underlying disease is diabetes, rheumatoid arthritis, lupus, vasculitis, those diseases absolutely need to be addressed. And if you're able to get, if you see those specialists that take care of you, and together with your healthcare team, you can manage those conditions pretty well, then your neuropathy symptoms should also therefore be managed. That makes sense. Go ahead, Karen.
Can neuropathy cause a foot to disfigure? Burn?
Oh, I'm going to let Dr. Thomas take this one.
Okay, so nerves innervate or power muscles, okay? Also sensation, okay, especially in your feet, including hands, all right? If you have poor sensation to the feet, your pressure points, meaning how you walk, can become abnormal, okay? There are a very common disease process associated with neuropathy and especially diabetes where the toes become crooked, okay? All right? That's misuse of your muscle groups and your pressure points when you walk, and over time that develops. So yes, lack of sensation, lack of appropriate use or electrical stimulation of muscle groups, especially the fine muscle groups in feet and hands, can lead to disfiguration.
Yes.
When you have cramps in your legs in the middle of the night, when you wake up, what does that mean? Does it have anything to do with neuropathy, or why would it happen? I was told years ago, when I was young, that during pregnancies, you get those cramps in your leg, you put your foot on the floor, and it's gone. Why would I have those cramps again now?
So there's a lot of different things that can cause muscle cramps. So it can be related to neuropathy, but oftentimes it's related to a magnesium deficiency. And so if you're having a lot of muscle cramps frequently, there are all kinds of topical magnesiums that you can try. If you ever have soaked your feet in Epsom salts and warm water, that's a topical magnesium treatment. That's what Epsom salts is. It's magnesium salts. And so you're actually getting magnesium in through your skin into your muscles, and that actually helps relax the muscles and reduces cramping. So you can actually take, but it all depends. There are a lot of different things that can cause the cramping sensations, and especially at nighttime. Some people get them after workouts, some people get them in the middle of the day. So there's a variety of reasons, and we can talk about it later.
Yeah, but I thought it might have to do something. So it has nothing to do with neuropathy.
Cramping is not a specific symptom of neuropathy. Okay, Candy?
You mentioned neuropathy with chemo and the treatments that sort of abate it, but is the neuropathy from chemo harder to treat than, say, neuropathy from, because that's the underlying cause, than, say, neuropathy from nerve damage or whatever other cause there might be?
I mean, the good thing about the nerve damage that happens with chemotherapy is at least you eventually stop the offending agent. Usually you don't stay on the chemotherapy forever.
Right.
So there can be some healing of the nerves, but it's like comparing apples to oranges, asking whether that type of neuropathy is easier to treat than other types of neuropathy. It still can be very difficult to treat.
So you would look for more of an underlying cause. If you still have neuropathy, you didn't have it before chemo, and then you have it after chemo, a year later for that whole year, there might be an underlying
You would look
cause.
at that specific drug and see, is this one of the more common or more serious adverse effects of that specific chemotherapy drug that you were taking. If it's not listed that as one of the major side effects, then yes, we would look for alternative causes of neuropathy, and not just pinpoint it on the chemo. And sometimes there are antibiotics that you could take that you could be on like once or twice and then develop neuropathy from those. So, it depends. It depends on every person, every individual in this room is different. You all have different levels of health. So it all depends on where you are when you interact with that drug or harmful substance, or whether it be tobacco, alcohol, chemotherapy, antibiotics, whatever it is that causes or infection or trauma that causes the nerve. You know, when people are younger and they definitely have better ability to regenerate nervous tissue. As we get older, we lose that ability slowly with time, but it doesn't mean that you can't. Any other questions?
I have a question.
Yes, ma'am.
I was diagnosed with this with my feet, and the doctor didn't believe me, so she took a needle and started picking on my feet until she got to a place where I jerked. Then she knew I had it. I asked her what I could do. This is 25 years ago. She said, "There's no cure for it. There's nothing you can do." Now I'm 95. When I'm walking, I can feel it's going up my legs. I'm losing my balance when I'm walking. I walk and stagger instead of walking straight, and I don't have the strength anymore. I never have had pain, but they're numb all the time when I go to bed, and they're numb. So I've never done anything about it, but I'm scared now of walking and not being, to fall and stumble all the time.
So what she's describing is being diagnosed with neuropathy, and this is the little test that she's talking about is actually pictured up here on the screen, right? That's what you experienced,
That's what
right?
you did to me.
So that's what we do. We test to see which parts of the bottom of your foot you can and can't feel, and that can help us determine where the nerve damage is, which peripheral nerve is actually being affected by the damage. So we're not just poking you just to poke you for fun. We really are. That's a real test that we're trying to figure out, which part of your peripheral nervous system is being affected. And sometimes that clues us into the cause, and we try to treat the cause. So I don't know, I don't know your doctor, I don't know the specific
Can I
service.
sign up with you to have a check?
We can go
I mean,
through
I have the doctor. I have,
Yeah, we can go through the workup.
Okay,
Yeah, we can go through the process.
I'll make an appointment.
Sounds good.
Thank you.
You're welcome. I believe Patrick, he was here in the back, and he's like our expert on how to sign up for SeniorDoc. But it's very simple. We really just need your insurance card information, and we check to see if SeniorDoc takes your insurance, and then we book an appointment. Any other questions or concerns? All right. Thank you all very much for being here. Greatly appreciate it.
Thank you, Brenda.
It's Dana.